Hello and welcome to talkhealth's webinar on hair loss, and I'm really delighted to introduce a friend of ours, a talkhealth expert, Dr Sharon Wong, who is a consultant dermatologist. I think, is that your correct title?
It is, yes.
Oh, good. So if you're a regular talkhealth member, you will have seen Sharon appearing on a number of our online expert clinics on dermatology with the British Skin Foundation. And over the last few years, Sharon has launched a great annual conference called Get Ahead of Hair Loss, which unfortunately was cancelled for obvious reasons this year. Hopefully it will be on next year. And I would encourage anyone to go and have a look at it, because I found it so interesting, and you do the best goodie bags. They are excellent. So yeah, they're great. So thank you for that. And then also famously with Michael Mosley recently on the BBC with, now I know I'm going to get this wrong as I've said to you earlier, the diagnosis detectives.
Yay!
Yay!
It is.
Yeah, and it was fabulous looking at it, and it's still available, I think, on iPlayer, isn't it?
It is, yeah. It's still available on iPlayer. It seems like such a long time ago now, but yeah, it's just jogged up all the memories of seeing those patients. But yep, it's still available on iPlayer.
And to be honest, I think so many of our members can relate, not necessarily to the exact issues that a lot of those people had, but it's going through the issues that they go through every day, whether it be pain, not wanting to see people,
yeah.
And is this ever going to get better, or what is it? I mean, it's very concerning, isn't it? And we all know it's very hard to get to see a dermatologist, especially nowadays.
Yes, and I think the real aspect of the diagnosis detectives was the fact that these people have been living with these symptoms and these problems for years without an answer. So that really was the crux of it, was to get them to some point of resolution, and so that they can move forward.
No, I think it's great, and the more we can highlight these things to people, the better. I think people feel that they can actually go to the doctor to start off with, to get the ball rolling, as opposed to just, oh well, it'll be all right, or cover it up, and not really sort it out. Anyway, so today we've got lots that we'd like to cover. So as I said, I think we might have to talk ever so quickly. First of all, I didn't realise that hair loss came under dermatology, but of course it does. But I'm not sure that everybody would necessarily know that. So the things that I wanted to cover were the common causes of hair loss. And also, when you start thinking your hair is going, where on earth do you start? Where do you go for help? Because I know also from the research we've done at talkhealth is that people wouldn't think to go to their doctors. It wouldn't necessarily cross their mind to. The other things is, what can you do to help yourself? Because I'm sure there's loads of things that one can do. And then perhaps, as time goes on, how do you minimise that hair loss? Is it possible to minimise it yourself or with management?
Yeah, absolutely. So
cover those, that'd be great.
Yeah, we'll try. You might have to invite me back for part two. Basically, you're absolutely right. Hair loss conditions and scalp conditions fall under the workload of a dermatologist. Now, that isn't immediately obvious, and I can completely understand why that's not obvious to the general public. But the hair follicle is a structure within the skin, and obviously the hair follicle shunts out the hair fibers. So embryologically and anatomically, anything to do with the hair follicle does actually fall under the remit of a dermatologist. It's actually a subspecialist area of dermatology, which I so happen to specialize in. And there are lots and lots of people with hair loss. And the problem that I have is that hair loss is often just bounced around as a term to encompass all types of hair loss, whereas actually there are so many different types of hair loss, some much, much more common than others. So, for example, the commonest ones that we see are genetic hair loss or common balding. Medically, it's known as androgenetic alopecia, and it can affect men and women. And of course, as the name suggests, it's got some hormonal influence, and it's also got genetic factors as well. And then another very common form of hair loss is what we call telogen effluvium, which is when you shed more than your normal baseline number of hairs. So our hair follicle goes through a cyclical life cycle throughout our entire lifespan. So we naturally will shed hair. And it can be anywhere between 50 to about 100 hairs a day, depending on how many hair follicles you have on your scalp. But if you're shedding more of that consistently, that is known as telogen effluvium, and people can actually experience quite dramatic hair shedding. And classical examples are after pregnancy, so postpartum shedding, or sometimes related to nutritional deficiencies like iron deficiency, or if you've undergone extreme stress. So it's a classical scenario where someone might have had a sudden bereavement in the family. A few months later, massive hair shed. That is known as telogen effluvium. So again, a really common form of hair loss. And then others such as alopecia areata, which is what we call an autoimmune condition. So it's when the patient's own immune system is attacking their hair follicle. It happens in about 0.2% of the population worldwide. And you get these typically sort of circular patches of baldness on the scalp most commonly, but actually it can affect anywhere. So eyebrows, beard hair, eyelashes, and it can be quite extreme. So people can lose all of their hair from the scalp, from the eyebrows, the body, the lashes. So it can vary in terms of how extreme it is. And then, I think with hairstyling, we see a lot of traction alopecia, certainly amongst certain patient populations. So I've looked after a lot of Afro-Caribbean patients, and with their hairstyling practices, traction alopecia is incredibly common. So there's some really, really common conditions, and you may find that during your lifetime, there may be some forms of hair loss which are more pertinent than others. So after pregnancy, you might get the hair shedding type. Maybe you then go through a period where you're trying to diet and lose weight, and you change your diet dramatically, and then you get another type of hair loss. And so it may change throughout your time. And, certainly being a woman, obviously we will have periods of time where our hormone status will change massively. Menopause is a huge one, but it also coincides with when genetic hair loss often kicks in as well. So more often than not, there's probably more than one thing going on. So it is important to see the right people to decipher what are the factors that are relevant to you right now and address those individually.
The other thing is about, I know we're not talking about turning grey, but people suddenly turn grey supposedly overnight through shock. And is that something similar can happen with hair loss, or is that sort of entirely different?
Well, in terms of shock and hair loss, as in an extreme sort of emotional stress trigger, we can see the telogen effluvium type of hair shedding. And we can also see alopecia areata. Now, alopecia areata is quite interesting because it tends to only affect the pigmented hairs, so the hairs that have got colour in them. So if you are somebody who has some grey hair, it tends to spare the grey hairs. So historically, there have been some anecdotal cases where people have undergone an extreme stress. They've actually had alopecia areata, which attacks the pigmented hairs. So literally you get that story of overnight it's gone white or gone grey, but it's just meant that the non-pigmented hairs were spared as part of the disease process.
So if you suddenly start noticing for whatever reason, and as you've explained, there's obviously quite a few reasons that that your hair, you start noticing your hair sort of falling out. At what point do you think well, first of all, who do you go and see? Do you go and see somebody? And how long do you let it go on for? Is it, so I know we all know, or it's a common thing, is it 100 hairs we automatically lose every day?
Up to. So it might not be for one individual 100 hairs is normal. It may be 50 is normal for that particular person. So going up to 100 isn't normal for them. It depends on the number of hair follicles that you have on your scalp. And basically that can range from 100 to about 150,000 hair follicles just on the scalp skin. So everybody's baseline number of hair sheds per day is going to be slightly different, but it can be up to about 100 and still be normal for that person. If your baseline shed is 50 and it's gone up to 100, then that isn't normal for you. And before long, you will start to notice that you get this shrinkage of the volume of hair. That, just being in tune with the fact that it's a deviation from normal, should start triggering you to find out what's caused it. And I know it's super tempting just to Google and find out the causes of hair loss, but the problem is, because there are so many different types of hair loss, you need to tailor your treatments depending on what factors are driving the hair loss in you. So you have to do a bit of investigative work first. And the first port of call usually is your GP. Now, through just a simple blood test, you can rule out some of the most common and easily correctable factors that could be contributing to the problem. So things like low iron, low vitamin D, thyroid hormone problems, or any new medications that you might be on that could be causing hair loss. Those things can be easily done by your GP. Now, if all of those things haven't thrown up any obvious cause, that's when you actually need to see somebody who specializes in hair. That brings me on to the next thing, which is, well, okay, do I see a trichologist or do I see a dermatologist, and what's the difference? So a trichologist, trichologists are a group of professionals who have been trained specifically in hair and scalp diseases and to look at the hair and scalp in health and also in disease. So they are hair and scalp experts. However, they are not able to issue any prescriptions because they aren't medically qualified individuals. So a trichologist may well be able to help you come to a diagnosis, and if it's quite mild, they can start trichological treatments. But if it's not working at that point, or if the diagnosis is not clear at that point, you need to see a dermatologist, because the likelihood is that you will need further investigations, maybe a scalp biopsy where we cut a little piece of skin under local anesthetic from the scalp in an area of thinning or hair loss, and actually see what's happening to the hair follicles under the microscope, and then move on with some prescription medications, which will only come from a doctor.
And I know this may sound a silly question, but it probably goes back to what I said earlier, is that, you know, I didn't realise that dermatologists actually specialised in hair loss. Are all dermatologists, you know, able to support people with hair loss? Or is it better to try to ask someone like yourself who's more specialist for it?
Yeah, I mean, dermatology is such a vast subject, and there are so many sub areas within dermatology that my colleagues will have subspecialized in. As a training dermatologist, so when we're working our way towards becoming a consultant, we get the whole exposure to the entire curriculum of dermatology, which includes hair loss and scalp conditions. So a general dermatologist will be able to diagnose and start initial treatments, prescription treatments for various hair loss and scalp conditions. Obviously, with me and some of my colleagues who subspecialize in hair loss, we tend to see the patients who perhaps are a little bit more complex. The diagnosis is still not clear-cut, or their treatments aren't working. So we tend to see the slightly more severe or more complicated patients with hair loss. But by all means, yes, a general dermatologist should be able to at least do the biopsy, give you a diagnosis, and start you on prescription treatment.
No, that's really interesting to know. And so as you said, and also, well, the one thing that I found quite shocking was, you know, absolutely how young men start losing their hair very young, much younger than I'd realised. And obviously, the psychological effect on that is huge, because quite often they could be teenagers, can't they?
Yes,
and it's oh my goodness, what do you do? So would you encourage those people to go to the doctor as soon as possible? Because is there any way to start slowing it down?
And that's absolutely the key, Katrina. So male pattern balding is incredibly common. It counts for more than 90% of the cases of hair loss in men. And the age of onset really tells you how strong that genetic trait is. So if you had family members who started going obviously bald in their 20s and early 30s, that's a much stronger genetic trait than if that family member started going thin and bald in their 50s and 60s. So yes, I have seen quite a few young men in their late teens, early 20s with quite significant hair thinning, really self-conscious about their appearance. And of course, hair loss at any stage is a difficult thing to accept and to work with. But I think it's so important at that time when you're just trying to find yourself and develop your own identity. And the psychological impact is huge, really, really huge. And I think if you have a family member or a friend or a colleague who is going through hair loss, I think the most damaging thing that could be done is to trivialize the problem, because all it means is that they won't want to talk about it, but inside they are really desperate for help and they want to talk about it. And this is what we want to do, and especially with things like Get Ahead of Hair Loss, is actually to create a positive, supportive narrative around hair loss. There is no shame in having this. There is no shame in actually getting help. Because actually the other thing that people don't realize is there's a lot that can be done, especially when it's really early. All your treatments for genetic hair loss are primarily aimed at preventing progression. So that means that the sooner that you start, the more hair that you retain. And there are some very good treatments that can halt progression And in up to about 60%, about 2/3 of patients may get some additional density, but you will require long-term treatment to maintain that. And there is just so much that can be done. So from a medical perspective, we've got licensed medications like minoxidil and finasteride. There's a whole host of other non-licensed treatments like dutasteride and oral minoxidil that doctors can prescribe. And of course, there are surgical interventions like transplantation, and these things can work together at different time points. So somebody who's in their late teens, early 20s would not be a candidate for a transplant because they have that many more decades left for that balding process to continue. But the emphasis for somebody in their late teens, early 20s is to halt progression, and that's where the medical treatments come in.
And I think one of the things that struck me when we first started talking was what I would call the charlatans out there, which is probably quite a strong word to use, but the people that offer these amazing, concoctions to stop hair loss, and people don't realise they should go to the GP first before they start spending their money on these type of, concoctions. And I know there's a lot of clinics up in London that are offering marvellous cures, and we all know that, certainly dealing with chronic conditions as we do, we know that cure is not a great word to be using.
No. I would always take any ads that say cure, 100% guaranteed, all of those things with a pinch of salt. With a big pinch of salt. And basically, the problem that we have with hair and hair loss solutions is it goes into the cosmetic world. And there are lots of products, cosmetic products, which from a marketing perspective aren't regulated in the same way as medications, prescription drugs are. So they can basically claim whatever they want to claim without that much regulation. But in my mind, what I try to make very clear to patients is that there are cosmetic products out there which really do a great job in maximizing the appearance of the hair that you have. So it could be volumizing, it could be thickening, those sorts of aesthetic properties, improving shine and fullness and manageability, all of that, that's in the cosmetic world. That's fine. Where you need to be careful is in that middle ground where it's like, oh, this hair growth serum can increase your density by another 50, when we're probably 50% or whatever it is, we'll get full regrowth within 6 months. This is where you have to be really, really careful because really the only licensed treatments for genetic hair loss in men is topical minoxidil and finasteride, which is a tablet. And for women, it's minoxidil. So really any additional ingredients, you do need to, take with a little bit of skepticism as to, how much it might actually help. Is it more conditioning your hair and making it look and feel nicer? That's very different to actually regrowing hair, preventing the balding process and improving density. There's two very different things, but because of marketing issues, I think those lines are blurred and it does make it very confusing for the consumer.
Yeah, and can be very expensive mistakes as well.
Totally. Yeah, absolutely.
Actually, there's two other things before we open the floor for people to ask some questions. I've got a couple of questions. I'll get mine in quick. Notice I did my hair today.
It's beautiful. You don't need to ask me any questions. I need to ask you for some hair.
They're not actually questions about my own hair. But now I've got to remember. Now you've thrown me. Now I've got to think about what the questions that I was going to ask. That's the trouble when you're menopausal. That's the thing. Which is obviously, and we know menopause is a big problem. So, and sort of that thinking about women, I mean, I've heard some shocking stories of ladies that have lost their hair. And whereas with men, I think we all say, all women say to men is, it doesn't matter. And it tends to be the men that are more concerned than the women about the hair loss. But I think for women, it's a completely different psychological thing in losing their hair or thinning and things like that. Is hair loss in women a different type of hair loss or the same type but slightly different?
No, I think there are, so the most common causes of hair loss that I mentioned are relevant to both men and women. But I think as ladies, I'm afraid we've got the rough end of the deal. I mean, we in our lifetime will go through massive fluctuations if we just look at what happens to our sex hormones in a lifetime. You may be on the pill, off the pill, switching pills, pregnant, after pregnancy, going through IVF, menopause. I mean, it's up and down, and your skin, your hair will respond to that. And of course, these are not the same sort of physiological changes that a man will experience. So the amount that our hair will suffer from as a result of those big fluctuations in sex hormones alone is huge, and will account for probably more of the hair loss problems and the hair shedding problems than men would probably see. As I said, 90% of the hair loss in men is purely male pattern balding. It's a much simpler group of conditions, whereas in women there may be also lifestyle factors, stress-related factors, but also hair grooming. Hair styling is a big thing for us, and so the heat styling tools, the dyes and chemicals, all of that will have an additional impact on the aesthetic appearance of the hair fiber. So then you get the textural changes and the fragility and the dryness and all of that, which is not as much of a problem in the male population.
Yeah. And then my other one was my concern also, and once again, this is from working with you, is the people that go to have a hair transplant, and quite often they're given a hair transplant when in fact it would never, I can't think what the right words you would do, it would never automatically accept it. Yeah,
so fundamentally with hair transplants, it is an invasive procedure, and it is, it's something that does carry risks of infection, risks of scarring. And on top of that, there is, a huge financial element to this. It's an expensive procedure. And unfortunately, there are lots of transplant surgeons who will just take on work, even though you're not the right candidate for it, or that you have other forms of hair loss, which mean that actually you are contraindicated to having a transplant. So there are a rarer group of hair loss conditions called scarring alopecias, where there is an inflammation around the hair follicle that can lead to scarring and therefore permanent patches of hair loss. Collectively, this group of hair loss disorders would not be suitable for transplantation, because the problem is that the transplant may reactivate the underlying disease and actually may destroy the graft. You may activate the disease in the area that you've actually harvested the graft. So you really do need to be in the right hands. Make sure that you meet your surgeon. It's the same surgeon that sees you in consultation right through to the surgery and the aftercare. Make sure you're absolutely clear that your diagnosis is completely right for transplantation, that you are the right candidate. So again, people offering transplants to 19, 20-year-old patients, it's not going to give you a lasting result, because that balding process has many, many more decades to continue. And so actually a very young age probably is not a good, makes you not a good candidate for transplantation in the first place. So I think checking with, reputable hair restoration societies. So there's the BAHRS, the British Association of Hair Restorative Surgeons. So they will have a registry of appropriately trained, accredited and regulated transplant surgeons in the UK. And I would strongly recommend you doing your homework and making sure that you're with a registered surgeon.
Yeah, that's really good advice, because I think quite often you don't necessarily know anyone else who you can't generally go, I'll start again. You don't necessarily know someone who's already had that operation, so you can't go by personal recommendations. And quite often it's one of those things that people don't even like to discuss they're going to have that operation, or even thinking about, is it? So that's really good advice. Thank you. So if I'd like to open up the floor, as they say, to questions. I know we've got a couple that I've seen that have come in, which is why I put my glasses on to try and read them. So we've got one from somebody who said, my hair has always been fine, but now it's thinner and still fine. I molt a fair amount, but don't have any baldness yet. So I'm not sure if that actually, having seen that, whether that's actually a question, or if there's anything that you might suggest that she could use, should be taking to supplement to make it slightly, thicker.
Okay, so the question really is addressing the fact that it's become thinner. So the caliber of the hair is still fine, and it always has been, but it's become thinner. So the question would be, are you shedding more hair? And if you are, if this change is associated with hair shedding, then back to the GP as your first port of call. Get those bloods done. Make sure that iron, vitamin D, thyroid hormone tests have all been checked. Just have a little look at any medications that you've taken, let's say about 6 months prior to you noticing those changes to your hair. Now, if they've all come back okay, and no obvious cause for that, then perhaps it may well be the really early stages of genetic hair loss, as being the most common cause of hair loss in both men and women. And really for women, it can come on at any stage from, usually the 40s onwards. But if you've got a family history, it may come on sooner than that. And in the super early stages of genetic hair loss, you won't get bald patches or areas that you can see your scalp. You just get, more shedding and progressively thinner hair. So it may well, first of all, be best to see your GP and just exclude those simple things.
Right, that's great. Another question we have is from a lady who says, I have vitiligo, an autoimmune condition similar to hair loss, and obviously you'll be very familiar with vitiligo. My hair seems to be very thin and I feel it's thinning slowly over time. Do you know if there's a connection between the two?
Well, autoimmune conditions like vitiligo, when it comes to hair, the autoimmune condition which we most commonly see is alopecia areata. The most textbook form of alopecia areata is when you get these circular patches where it's completely lost hair, typically on the scalp. But there are less common forms, like a diffuse alopecia areata, where you can just shed lots and lots of hair and lose it very, very dramatically. But that really is quite dramatic. There are a battery of blood tests that we generally tend to do for patients with hair loss. And one of these blood tests also includes lupus. Because sometimes lupus, which we know is an autoimmune condition, can also, if you carry the positive antibodies, generate some hair shedding and some hair thinning over time. In that panel of blood tests as well will also include thyroid disease, which we know that a significant proportion of thyroid disease is autoimmune in nature, so it could be to do with your thyroid. So hence, once again, battery of blood tests, the alopecia blood screen, which will include all of those things to see if there's any other autoimmune cause for your hair loss. And if, again, those are not coming up with anything, I would suggest you probably get a referral in to see your dermatologist.
All right, Brill. Next one. If you've been recommended to use now we've got the word here. I don't know if you can see those questions, Sharon.
A minoxidil product. Yeah.
How safe is it to use? Can you use it? Is it only short term or is it a long term?
So no, topical minoxidil was formulated for the long-term management of genetic hair loss. So as I said before, the whole idea of starting treatments is to prevent progression. It isn't a course of treatment like 6 months or a year. You actually have to maintain the treatment to maintain the effect. And actually, if you stop the minoxidil, usually within about 4 to 6 months, you will start to go back to a baseline of hair density as though you'd never been on anything before. So when you come off the minoxidil, you very often do shed quite a bit of hair, and that's basically you losing any of the hairs that you would have retained by being on the product in the first place. So if it's working for you, it is something that you do need to maintain long term. And it is completely safe. So most of the side effects that you get from minoxidil are mainly topical side effects, so the scalp irritation. Some people get some facial hair growth. When you start the product, you can get a bit of transient shedding. Very rarely will you absorb enough of it for it to affect your blood pressure, because minoxidil was historically a blood pressure tablet. But putting it onto the scalp directly, very rarely you absorb enough of it for it to affect your blood pressure.
But I think quite often, and that's the trouble, is that the GPs don't have, if it's a GP that's diagnosed, would a GP prescribe that?
Well, it's available over the counter. So minoxidil is available as a solution. It's also available as a foam. And you can get those without a prescription, just over the counter.
Right. But I think what's great is hearing you to say the things that happen. So some of the side effects that you can get. So like you said, when you stop taking it, your hair starts falling out. And I think you might suddenly have a panic that, oh my goodness, it's all going to fall out. But understanding, so it is important to read the side effects and what can happen, but without terrifying yourself. I think that's also the other problem when you start reading. What are the side effects?
Also, with minoxidil, when people have been very proactive and started it really early, and they're sort of expecting sort of a dramatic plume of hair, but actually what you're trying to do is stop things from getting any worse. And they may be tempted to just discontinue treatment because they don't think it's doing anything, only to then find out that they start shedding anything that they would have sort of preserved whilst they've been on treatment. So, minoxidil has been around for decades. It's got a very good track record of success. Yes, as with all of these treatments, starting early gives you the best chance of getting a really good result.
So very quickly, because I know we've just now run over our time, as we knew that we would, because we still have
I know. That's okay. It's a big topic.
a couple of quick questions then. If hair loss is secondary to medication, if you stop the medication, will you get regrowth?
Yeah, so most medications will cause the telogen effluvium type of hair loss. That's the disturbance of the hair growth cycle. So you're going to shed more hair than you normally do. Now, when you stop the medication, there will be a slight lag phase for two reasons. First of all, the resynchronization of that hair growth cycle takes time. Secondly, it will depend on the half-life of the drug. How long does that drug take to get washed out of your bloodstream? It doesn't get washed out immediately the day after you stop taking it, it will still linger, and that will be dependent on the pharmacokinetics and the pharmacodynamics of the drug. So there may be a bit of a lag phase. However, if you're looking at things like chemotherapy, which of course is a very common cause of hair loss, this is a very different type, a different group of medications which actually target the hair follicle matrix cells, so the cells which are the powerhouse at the bottom of the hair follicle that shunts out the new hair fiber, because they're so rapidly dividing, and that's exactly what chemotherapy drugs are there to do. They are to target the most rapidly dividing cells, i.e. the cancer cells, the gut cells, which is why you get awful gastrointestinal symptoms, but also the hair follicle cells. That can give you anagen effluvium, which is when you lose all of the hairs in the anagen phase, which are over 90%, which is why most patients who have hair loss with chemotherapy actually lose virtually all of it. And depending on which chemotherapy drug or a drug that you're on, it will tell you whether you're likely to get recovery and roughly how long it might take for that recovery to happen. But there are some chemotherapy drugs, unfortunately, that can lead to permanent alopecia.
Right, and would your surgeon be able to tell you that, or is it dependent on how you react to that drug as well?
So your oncologist will be able to tell, just based on their experience and knowing that particular class of drugs, what the expected time span would be. Most of the time when you finish the chemotherapy, maybe within about 3 to 6 months, you might start getting a bit of the fuzzy regrowth for the non-permanent forms. But, you know, the oncologist will be the most familiar with those chemotherapeutic drugs, and so they will be able to tell you if there is a chance of permanent alopecia with those.
Because I think, you know, for the people that I know who've unfortunately had to go through this, hair loss, particularly for a woman, is a huge part of the cycle of sadly having cancer. So yeah, I think it's very important to know. If you know in advance, then you can start preparing yourself, really.
Absolutely, yes, absolutely. And there are lots of things that can be done to try and prepare yourself. Having that psychological support network is really important, but there are sort of temporary cosmetic treatments that can be looked into even before you start the chemotherapy. So, and then if it is a non-permanent form of chemotherapy related hair loss, then we can use oral minoxidil to encourage hair growth after you've completed your treatment with chemo.
Right. We've actually got quite a few, but I'm just going to ask one more. That's it, one more, then we're going to stop. Are there any vitamins or minerals I can take to help boost my hair growth?
It's a really common question, actually, and it's a good one because I think a lot of people end up just bringing me bags of vitamins and minerals that they're taking. And my belief is that there is no additional benefit of taking vitamins and minerals unless you've actually got a specific deficiency in the first place. Your hair follicles are very nutritionally sensitive, and it requires everything. There isn't like a superfood or anything that's going to sort it out. What it needs are all the macro and macronutrients. You need the carbs, you need the fats, you need the proteins, you need everything from a balanced diet. I think if you are at risk of developing certain nutritional deficiencies, in women in particular, low iron is a very common one from cumulative menstrual losses and maybe insufficient iron intake dietary wise, but also vitamin D. So I would suggest getting a blood test with a GP, establishing whether you are deficient in specific nutritional elements and replacing those individually. What I don't really advocate is sort of blanket vitamin supplementation, because I think people don't realize there are hazards with over supplementing as well. A prime example would be something like biotin, which is everywhere. If it's hair or nails, it's biotin. There's actually very little data to support biotin supplementation for hair growth. And excess of biotin can actually hamper the interpretation of some other blood tests. So if you had blood tests for sex hormones, thyroid hormones, or if you're being investigated for chest pain, that blood test, the troponin, which is a marker for a heart attack, can be affected by excess biotin. So I think you've got to be aware of there are hazards of over-supplementing, and it should be targeted.
Right. I'm really afraid we might have to get you back. You're right.
It's a complex topic. I thought it was a bit ambitious for half an hour, but anyway, I've enjoyed it. It's been great.
No, it's great. And, you know, the video is now available, will be available for at least 12 months on talkhealth for people to go and look back on. And I just think hair loss is something that I hadn't realised was such a huge topic, you know, and I think if you suffer from it, then you know. But I suppose I should be aware of that because there's so much stuff in Boots or any other drugstore, isn't there? So
yeah, it's a minefield. It really is.
Well, thank you so much for sparing the time, because I know that you're hugely busy. You're hugely busy actually treating patients, and I know that, you know, the showbiz side of it is not what you're here for. You're here to help people. That's the important part for you. And
no, absolutely.
Thank you very much for your time again.
Thank you. It's always a pleasure.
Lovely. Thanks, Sharon.
Bye. Bye.
Can't stop the video.